Hi everyone, Dr. Jeff back here this week for my holidays. I was out in the eastern townships of Quebec. Very beautiful spot to go. So I'm back this week. So Colin, what are we going to talk about this week?
So here at Goldsworthy Wellness, we're one of the few clinics that offers spinal decompression therapy. And what this is it's a way to regenerate your discs. So it's really good for people with spinal degeneration, a disc bulge, or a disc herniation.
So decompression is all about your disc, trying to regenerate your disc. So your disc has two components. It has this outside shell, outside ring, a cartilage called it's fibrosis, and a soft center here called your nucleus pulposus. The disc is really thick, it's nice and big, leaves lots of room for the nerves to come out the side, and it's very, very healthy. What can happen though is those rings will start to crack as discs start to degenerate. The rings will start to crack, and now gravity pushing down can have to push that little bulge out through the cracks. And we notice now that disc is getting kind of thinner all through. All right. At any given time, majority of Canadians have a disc bulge somewhere in their spine. If it's coming out the front, you probably won't even notice you have it. Problem is, if it starts to come out the back or the side and starts to pinch that nerve, that's when you start to get pain in your shoulder blade and goes down your arm, or pain in your butt and goes down your leg, kind of like sciatica. And that's kind of the first stage to degeneration. The next stage is called a herniation. And what can happen now is that bulge will actually break. When that bulge breaks, you actually start to leak the nucleus out through the spine. Now what you're going to find is that you're getting these osteophytes, these bone spurs are starting to form. That disc is starting to get really, really small. The body's starting to try and bridge this and try and stabilize it. And now what happens, because the disc is so narrow, there's really not a lot of room for this nerve to come out, and it's getting more and more pressure being put on it. The last stage you're going to find is this stage here. This is where there's no real disc left in the spine, in the disc. You got these big honking osteophytes now. There's really no space for that nerve to go anywhere. And at this point in time, there's really not much we can really do to regenerate that disc. This is where you end up, your only choice is really surgery. The difference between traction and decompression is traction is designed for muscles. Traction is going to pull you in a straight line. So it kind of goes in line with the muscles. So when you are getting traction, you're going to feel it. It's going to be pulling on the muscles. Decompression is very gentle. The whole idea is we're going to try and create a vacuum inside the disc, or a pressure differential. So with decompression, we pull you on an angle. So L5 would be 10 degrees, L4 15 degrees. We're doing your neck, C5 is 8 degrees. So we're going to gently open and close that disc up, trying to create a vacuum inside. What that does is like taking a straw and going and sucking the bulge back inside. We're also trying to get nutrients and energy and water back into that disc and trying to regenerate it. So that's the difference between decompression and traction. So once we get you harnessed up, we're going to get you on the machine. We start you in the upright position here. So Colin's going to hop on the machine there. So once we have Colin down this position here, we'll be hooking the top strap up here to the very top. And then this one here, we hook up to the machine down here. And again, depending on which disc we're going to go after, this is going to go up. Right now it's going to go to L4, so we're going to be going up to 15 degrees. And once you push start, there's 18 cycles. So you're just going to gently rock them back and forth. This way here, you're on the machine for 21 or 28 minutes. There's 18 cycles to gently open and close that disc up.
So that's spinal decompression. And like we mentioned before, it's really only good if you have any disc issues, so disc herniation, disc bulging, or disc degeneration. And if you feel like this is something that you could maybe benefit from, you can always come in for a free consult or bring it up with Dr. Jeff or Dr. Adrian at your next appointment. So if you liked the video today, make sure to leave a thumbs up, make sure to follow us on YouTube and Instagram. And if you have any questions about what we talked about today or any suggestions for future videos, make sure to email us at jgoldsworthy@goldsworthywellness.com. And as always, here at Goldsworthy Wellness, we got your back.